In 2021, more than 48,000 Americans died by suicide. It is the 11th leading cause of death in the U.S. This is why advocates with American Foundation for Suicide Prevention have been urging lawmakers to prioritize mental health initiatives for all Texans. Nicole Jenkins, volunteer and advocate with American Foundation for Suicide Prevention, joins us this morning to talk more about what those initiatives are. How are you? Thanks for coming.
Yeah, thank you so much for having me.
Yeah, definitely. So what support are y'all looking for from lawmakers, first of all?
Absolutely. In general, we're looking for support around mental health care initiatives and suicide prevention. Three key areas where we're asking for support this legislative session. One is supporting 988 and crisis prevention. As you may know, 988 was designated as the mental health emergency hotline, similar to how 911 works for physical health emergencies, but we need additional support to make sure crisis centers are funded and people are there to answer the call and send support. Second is around expanded mental health care training, allowing local behavioral health specialists to receive grants that can allow us to provide mental health first aid training to more individuals in our community. And the third is supporting our LGBTQ youth by opposing legislation that would ban gender-affirming care or prohibit discussion of sexual identity or gender identity in schools. As we know that our LGBTQ youth are a population that are particularly at risk, we want to support them by creating an inclusive community to prevent suicide.
Yeah, and the initiatives that we're talking about, is that what you just talked about, or is that separate? Those are the initiatives.
Those are the legislation that we're asking our legislators to support or to oppose as part of this session to help us to prevent suicide in our community.
Yeah. So talk about mental health and suicide prevention in general. Why is it such a taboo and difficult topic to discuss?
Yeah, it's a great question. I think that there's still a lot of stigma and a lot of misunderstanding around mental health challenges, and especially around suicide. I think it's important to know that there is no one cause of suicide. It can be a really complex issue, and a lot of people that die by suicide have pre-existing conditions at the time of their death. And so I think it is difficult for people to admit when you are struggling, though it shouldn't be. And I think especially in the wake of this post-COVID era, where a lot of people struggle with their mental health, being stuck at home, I think people are becoming more open to admitting when they need help or having that conversation. But it remains to be tough because there's a lot of stigma surrounding it, or a lack of tools and how to have tough conversations about how we feel or when someone might be at risk.
Yeah, and 988 is something that we read often. We're about to read it here in a second, and it's something that you can text now as well.
Absolutely.
You text it and you call.
Yeah, it's super easy to call in, to text. Someone will be there to answer, to help, to support you. Or if someone that you're with is in crisis, you can call on behalf of them as well. So it can be a great resource in those moments where someone is in potentially a mental health emergency.
Yeah. How can people get more information? How can they help you guys?
Absolutely. Go to afsp.org/advocacy. There you can see some of the additional legislation and initiatives that we are supporting. And you can also sign up to be an advocate. We have a great system where put in your information. We'll let you know when there's legislation that you might want to support or speak to your representative about, and provide an easy template to reach out to them. So it's a super low effort but high impact way to get involved and contact your own legislators.
Yeah. Nicole, thank you so much. Anything else we need to know about this?
I would just say that if you're worried about someone, assume you're the only one that's going to reach out. I think that's the most important thing, is having that conversation and just being a voice to let them know you're here to listen can be so much more impactful than you know.
Thank you so much.
Thank you for having me.
And if you or someone you know is in distress, there's always help available. Just call or text the number 988. It's the Suicide and Crisis Lifeline. Help is available 24/7. We'll be right back.